Do you want to get tested for sleep apnea but don't want to stay in the lab? Well, this video is for you. Hi, my name is Dr. Val. I'm an integrative sleep medicine physician and women's sleep expert here today to talk all about home sleep apnea testing, or HSAT. Really, the reason to do a home sleep apnea test is because it's a lot cheaper for insurance companies. The way we practice medicine here in the United States, we do a lot of cost savings. Typically, people who do go overnight to a lab to have an attended sleep study are people who have more serious medical concerns. Maybe somebody has heart failure, or an irregular heartbeat, or a seizure, or maybe they need oxygen at night. And these are certain conditions that are best monitored in the lab with a technician. Most of the general population can be studied at home, and personally, I think it's the way to go. One of the main reasons is that it's a lot more comfortable. At night when you sleep, if you're not comfortable, if you have all these wires on your body, then it may not be best representative of how you typically sleep at night. In regards to home sleep apnea testing, there are so many different types available. Some of the more traditional kits have a nasal cannula that you put in your nose, and that helps monitor the air moving in and out. Additionally, it may have a belt that you wear around your waist or chest to monitor if your lungs are moving. Typically, most of them do have something on your finger to measure your oxygen and your heart rate, and really what we're looking is for your flow. How many times an hour is your airway narrowing or collapsing to the point where you have difficulty breathing? I often get asked, how accurate are these home sleep apnea tests? Are they really definitive in defining if someone has obstructive sleep apnea or not? Well, it really comes down to your pre-test probability. What signs and symptoms are you having that would prompt you to have a sleep apnea test to begin with? Typically, those are snoring, gasping, or choking, or feeling tired throughout the day. However, we know for women, especially women going through maybe perimenopause and menopause, you may not have those symptoms. You may feel like having a headache in the morning, you may feel fatigued, you may have some mood disturbances, or you may just have insomnia. I have a very low threshold for ordering sleep apnea tests, and I think the home tests are definitely helpful, but it is definitely not the end of the road. Meaning, if you do have a home sleep apnea test and it doesn't show you have obstructive sleep apnea, I would recommend going to the lab. The main reason for that is in the lab, they can put the EEG leads on your head. Some people have a type of sleep apnea where their airway partially collapses and their brain wakes you up before it completely collapses. And that's something that's missed at home because at the moment, we don't have the technology to do a good job for our patients to self-administer EEG. I think we'll get there eventually. Another type of test that we can use is something called the Whisper, and it bypasses the need for a nasal cannula or even a belt. It's really cool. There's these two patches and it syncs to your phone because it uses your phone as a microphone. One goes underneath your right side and then the other one goes over your belly button. And based on how your lungs and abdomen are moving, that monitors your airflow, which is pretty phenomenal because it's a lot more comfortable than having all those wires on. There are other tests that look like watches. One of them in particular is called the Watch Pat, and it's a device that goes over your wrist and on your finger. And that can tell whether or not you have difficulty breathing based on how long it takes the heartbeat to go through the whole system. There's other tests called the Night Owl, which is a little button that you put over your finger. It's measuring your oxygen and your heart rate. A special signal from that can monitor breathing. And then another one is called the Sleep Image, which is like a ring. Many different types of tests available. However, one thing to keep in mind is that home sleep apnea tests are really just looking for your breathing and your oxygen and maybe your heart rate. Some have positional sensors, some don't. Some don't even measure snoring, which I think a good test is going to have all those parameters. If you are someone who has difficulty sleeping, but you're not clear if you have obstructive sleep apnea, meaning you're lower risk, going to the lab is helpful because it looks at your different stages of sleep, right? There's 4 different stages, 1, 2, 3 in REM, and sometimes people want to know, are they having deep sleep? Are they going into REM? So the in-lab test is really the gold standard to tell us if this is happening or not. Some of the home sleep apnea tests say they can detect this, but I question their accuracy for that. Additionally, going to the lab can also help rule out or rule in any movement disorders. Some people act out their dreams when they sleep at night or even kick their legs, and they don't actually have sleep apnea, and that could be a reason why they have disturbed sleep. So hope you found this video helpful, learning a little bit more about the differences between home sleep apnea testing and in-lab testing. To learn more about women's sleep health, please sign up for our newsletter. The link is below. Until next time, ladies, sleep well.